Hello, thanks for joining us. It seems our efforts are paying off in the coronavirus fight. New cases have dropped and new figures this morning show most of us are towing the line on isolation. 90% of us are avoiding public places. Even more of us are keeping our distance from each other. It's a major milestone on the road out of here.
But there is a big but today, a massive blow for Virgin this morning. The airline is going into administration with 16,000 jobs uncertain. Predictions too that 1 in 4 Australians will soon be out of work. National Cabinet meets today with discussions on easing restrictions high on the agenda. Leaders will also move to end the ban on elective surgery. And Prince Philip has come out of retirement to thank key workers for ensuring life continues in England. Overseas, and Spain has now passed 200,000 cases, second only to the United States. 185 countries have cases of COVID-19. More than 2.4 million people have now been infected globally. The death toll is at 167,000, but almost 637,000 people have now recovered. Here's Nat.
Around Australia, there have been 13 new infections reported in the past day. There are 6,623 confirmed cases. The death toll stands at 71. Almost 4,300 people are listed as recovered. New South Wales increased by 6 cases to 2,963. In Victoria, there are 1,329 cases of COVID-19. In Queensland, the total remains at 1,019. Western Australia has 545 confirmed cases. South Australia has 435 people with coronavirus. Tasmania has reported 200 cases. There are 104 in the Australian Capital Territory, and there are 28 in the Northern Territory. Live now to our team of reporters for the new developments this morning. First to Bianca Stone at Virgin headquarters in Brisbane. Bianca, the airline is preparing to announce it's going into administration.
Nat, good morning. The airline will announce to the ASX this morning that Virgin Australia has gone into voluntary administration, formalising that process. Virgin Australia has been crippled by $5 billion in debt. It's failed to find an investor. It had asked the federal government for a $1.4 billion bailout package. So far, the government has refused. So administrators will move in. But exactly what that means for the airline's thousands of staff is unclear, whether they will get their entitlements. What it means for travellers is also uncertain. There are $1.2 billion in forward bookings for Virgin Australia and for Velocity members too. The website crashed last night with people trying to cash in their points. We now know that Virgin has stopped anyone from redeeming points on their Velocity system. So Richard Branson has weighed into this. He has released a statement. In it, he says he's hopeful Virgin Australia will emerge stronger, but has warned if Virgin Australia disappears, Qantas would effectively have the monopoly of the Australian skies. We all know what that would lead to. Nat, all of this as New South Wales and Queensland squabble over where the headquarters should be, that now seems irrelevant. If there's no airline, there's no headquarters.
Well, Taylor Aiken is in Canberra. Taylor, discussions will get underway today for the possible lifting of some of the lockdown laws.
Good morning, Nat. That's right. Our leaders say they've been encouraged by the low rates of new cases each day. And so today, the Prime Minister and the leaders of the states and territories will meet to discuss those finer details of how and when these measures will be lifted. Premiers have warned, though, that these measures won't be lifted anytime soon. At least in 3 weeks' time, they will consider lifting them. And that's despite mainland Australia having just 8 new cases that were recorded yesterday. Pubs and clubs and restaurants are unlikely to be on that list of those restrictions being eased, saying those mass gatherings are still too dangerous in terms of new cases. But these restrictions are having a profound economic impact, with new data from the Grattan Institute finding as many as 3.4 million Australians could be out of work in the coming weeks, with social distancing crippling industries like hospitality. However, the government's landmark JobKeeper wage subsidy package is expected to keep the official unemployment rate low. Also on the agenda today is that ban on elective surgeries. It is expected that that will be lifted. Nat.
Let's go to Nathan Templeton in Melbourne. Nathan, an 8-year-old's birthday party has resulted in $26,000 in fines.
Nat, it ended up being a very expensive birthday bash. On Sunday in Beaumaris, neighbours noticed a large gathering of people at a house and spilling out onto the street. They called police, who broke up the party, and now 16 people, including the hosts, have been each fined $1,652. On the whole, though, most Australians are doing the right thing, or at least that's what they told a survey in The Australian today. 98% say they're social distancing, 90% avoiding public places, 29% of us are working from home, and a similar number keeping kids home from daycare and school, and 14% wearing masks. In most categories, women are more compliant than men. Nat?
Sam Brett is in Sydney. A plan is underway for New South Wales students to get back into the classroom.
Yeah, Nat, there has been some confusion for the 1.1 million school students across New South Wales as to exactly how Term 2 will look. Well, we are set to learn more about that in about an hour's time when New South Wales Premier Gladys Berejiklian addresses the media. We do know that Term 2 is starting next week and that the students will continue to be learning from home for at least 2 weeks. Then there will be a roster system. So how that will look, well, students will start to go to school face-to-face with teachers 1 day a week. That will most likely start on May the 11th, but that all depends on how the virus rates are going across New South Wales. If those virus rates remain low, then those days at school will increase. New South Wales is certainly hoping to avoid the blunder that we saw from the Queensland government yesterday when that learning from home website crashed very early on, leaving students twiddling their thumbs. The New South Wales government still has a few more days to iron out the kinks, Nat.
OK, thanks very much, Sam. As the global coronavirus death toll nears 167,000, Germany has started to slowly ease lockdown measures. Meantime, US oil prices have fallen below $1 a barrel as storage capacity runs out. Let's bring in our foreign correspondents for the latest. First to Europe Bureau Chief Hugh Whitfield in London. Hugh, some businesses have been allowed to reopen.
Now, Germany is one of the few countries that has managed to now contain and control a coronavirus outbreak. Some tentative steps to reopen the economy today. They have allowed some small retail shops in much of the country to reopen, but almost everyone has to wear masks outside, particularly on public transport. Some senior school students have been allowed to go back to school as well to sit some crucial exams. In Poland, Norway and the Czech Republic, they are also beginning to reopen parts of their economies too. But here in the UK, the lockdown will remain pretty strict and in place for at least another couple of weeks. Almost everyone has to respect it, including members of the royal family. The Queen and Prince Philip are out at Windsor Castle, where the 98-year-old Duke of Edinburgh has released an exceedingly rare public statement, heaping praise on the medicos, professors and researchers who are trying so hard to find a vaccine to fend off coronavirus. He's also made mention of essential workers like delivery drivers and postal workers, saying, on behalf of those of us who remain safe and at home, I also wanted to thank all key workers who ensure the infrastructure of our lives continues. So tens of thousands of people being acknowledged right across the UK. No.
And 7 News US Bureau Chief Ash Mullaney on Wall Street. This is the first time in history that it's dropped into the negative.
Yeah, economists have never seen anything like it now. Oil companies are in a position now where they are paying to have barrels of crude taken off their hands because there's a problem now where there's just, they're looking at running out of storage in America because demand has fallen through the floor. Of course, people aren't flying, they're not driving at the moment. So this is concerning news for the economy. Donald Trump is speaking at the White House right now. Ever the optimist, this was his assessment just moments ago.
Based on the record low price of oil that you've been seeing, it's at a level that's very interesting to a lot of people. We're filling up our national petroleum reserves, the strategic reserves, and we're looking to put as much as 75 million barrels into the reserves themselves.
Interesting's a good word for it, Nat. This is just uncharted territory for America. As you said, we've never been in this situation before where the oil prices plunged into the negative. And of course, we are seeing protests right across the country at the moment. Americans eager to get back to work. These anti-lockdown demonstrators that have been protesting across the country. But governors, of course, are warning that this could be dangerous if we reopen too soon without widespread testing.
OK, thank you, Ash. Prince Harry is under pressure after claiming the UK's COVID-19 crisis is not as bad as we're being told. His comments come despite frontline medical workers suffering from a serious shortage of personal protective equipment.
I think things are better than we're led to believe through certain corners of the media. It can be very, very worrying when you're sitting there and the only sort of information you're getting is from certain news channels. But then if you're out and about or you're on the right platforms, you can really sense this human spirit coming to the forefront.
There have been more than 120,000 cases of coronavirus in the UK and 16,000 people have died. One of those on the front line is Professor Hugh Montgomery, who's been working in ICU wards in London. Good morning to you. What do you make of Prince Harry's remarks?
Well, the first time I've heard them, and I have to say that I'm not quite sure whether he's talking about things not being so bad in terms of spirit, which is probably true. All around the world, people are fairly resilient. But in terms of whether it's true that things aren't so bad in the medical side, then he'd be wrong. It's very hard.
Yes, talk us through that, because that seems to be how it was taken around the world, and that seems to be the uproar, doesn't it?
Well, so I hear. I've not really followed the story, I have to say, but the numbers are substantial, as you've heard. We have 16,000 deaths, and you've only got to look back at the last few weeks to see that rate of death has been going up very steeply indeed. And whilst we've plateaued probably, I think, in London maybe a few days ago, the rate of increase has plateaued off. We're still getting plenty of admissions every day, and we hope for a slight fall from there on in. The ward's still choked with COVID patients. The intensive care units are still full. Those patients remain very sick, and it takes a very long time for them to get better indeed. Most of our patients are being ventilated for several weeks as more patients come in. So we're getting congested and with increased numbers of sick patients. So it's far from simple and easy in the hospital front line.
Here in Australia, we have a lot of people with friends and relatives in England, so there is huge interest here. Can you explain why the death toll, it's not counting the people who die in nursing homes or at home, is it? Why is that?
Well, I think it should be making effort to, in a death certificates, list COVID-19 as the likely cause of death. They'll be counted. But there is always, firstly, a lag between recorded deaths and them reaching the statistics. And secondly, sometimes it isn't certain that can be put as a cause of death. Obviously, in a hospital with blood tests, testing for the serology, for instance, or getting the PCRs done, we can know for certain whether it's coronavirus. And the blood test will tell us that it's highly likely. But if someone becomes unwell in a nursing home, it'd be very much more a matter of conjecture as to which virus they actually died of. So I suppose it's hard for someone, hand on heart, to say with certainty what someone died of at home. So the numbers are almost certainly higher than they appear.
Right, OK. We wish you well, Professor, and we thank you sincerely for your time this morning.